OpenAI just gave you access to something that could change how you manage your health forever. One dashboard, all your medical records, your blood work, your wearables, your genetic data, analyzed by AI, personalized to you. Sounds incredible, right? But here's what most people will get wrong. They'll either ignore it completely, or they'll trust it blindly. Both mistakes. And I'm going to show you the smarter path. I'm basically a clone of Ronald. Since I spend all day working with AI, it only makes sense for me to use it in my videos too. Now let me show you what ChatGPT Health actually does, why it matters, and most importantly, how to use it without losing control of your own health decisions. Here's the problem we've been living with for decades. Your health information is scattered everywhere. Lab results in one portal, fitness data in another app, medical notes buried in some PDF you downloaded 3 years ago. When you try to make sense of it all, you're completely on your own. You spend hours researching symptoms online, reading conflicting information, showing up to doctor appointments unprepared, leaving confused about what your test results actually mean. And let's be honest, your doctor has maybe 15 minutes with you. They're overworked. They can't sit down and explain every single number on your blood panel. So what happens? You leave the office still confused, still uncertain, still searching for answers at 2 in the morning. This is the system, and it's been broken for a long time. Now here's what OpenAI is promising with ChatGPT Health. One place for everything. Your medical records, your wearable data, your fitness tracking, your nutrition logs, all connected, all analyzed, all personalized to you. Want to understand your cholesterol trends over the last 2 years? Just ask. Need a summary of your blood work before your next doctor's appointment? Done in seconds. Curious which questions to ask your doctor based on your specific genetic markers? It can help you prepare for that conversation. They've worked with over 260 physicians across 60 countries to build this. They've collected more than 600,000 pieces of feedback from real users. The goal is simple. Help you understand your own health better. Prepare you for conversations with your doctor. Spot patterns you'd never notice on your own. Let me give you a concrete example of why this matters. There's a gene mutation called MTHFR. If you have this mutation, your body struggles to convert regular folate into its active form. This can cause elevated homocysteine levels, cardiovascular issues, fatigue, brain fog, all kinds of problems that seem unrelated. And here's the frustrating part. Solutions exist, but most people don't even know they have this mutation. So they never think to ask their doctor about it. They just live with the symptoms, thinking it's normal. That's the real problem. Not the mutation itself. It's not knowing you have it in the first place. Before tools like this existed, figuring this out required hundreds of hours of research, reading scientific papers, listening to specialized podcasts, digging through forums. Now, you upload your genetic data, ask the AI what you should know, and it tells you in plain language what that mutation means and what questions to bring to your doctor. What used to take months of research now takes minutes, and you walk into your next appointment actually informed. If you're finding this valuable, hit that like button. It helps more people discover this content, and it tells me to make more videos like this one. Now let me show you where this gets really powerful. Imagine combining your nutrition tracking with your blood work, with your sleep data, with your genetic profile. There are apps now where you snap a photo of your meal and AI analyzes the calories and macros automatically. No manual entry, no searching databases, just point and shoot. Connect that with ChatGPT Health, and suddenly you've got a system that knows what you're eating, how you're sleeping, how much you're moving, what your blood markers look like, and what your genes say about how you process different nutrients. Now imagine this scenario. You walk into your doctor's office. You pull out your phone. You show them a complete summary of your health over the last 6 months. Trends, patterns, questions you want answered. Instead of starting from scratch every visit, you walk in prepared. Your doctor sees the full picture. The conversation becomes about solutions, not just gathering information. This is the future of healthcare, and it's available right now. If you're getting value from this, hit subscribe. I break down AI developments like this every week, so you never miss what actually matters for your business and your life. Now here's the part where I need to be real with you. This technology is powerful, but powerful tools require responsible users. OpenAI says your health conversations are not used to train their models. They've built additional encryption, separate storage. Your health data stays private. That's good, that's important. But here's what I want you to understand. No AI system, no matter how sophisticated, knows you better than you know yourself. The AI doesn't know about the stress you've been under lately. It doesn't know about your family history that never made it into any medical record. It doesn't feel what you feel when something's off in your body. AI is trained on data. Millions of data points from millions of people. It finds patterns. It makes predictions based on statistics. But you are not a statistic. You are an individual. And sometimes the right answer for the average person is the wrong answer for you. This is exactly what I do every day at Data Wonder. I build AI voice agents and automation systems for businesses. The kind that answer your phone at 2 a.m., process your invoices while you sleep, handle customer questions without you lifting a finger. It's not about replacing people. It's about freeing them up to do work that actually matters. And the same principle applies to your health. The goal isn't to replace your judgment with AI judgment. The goal is to use AI to gather information faster, to spot patterns you might miss, to prepare you for better conversations with real doctors. You stay the pilot. AI is your co-pilot. Let me give you a real example from my own work. I built a system for a medical clinic. They were drowning in patient intake calls. Same questions over and over. Insurance details, appointment scheduling, prescription refill requests. Their staff was spending 5 hours a day just answering phones. 5 hours they could have spent actually helping patients. Now an AI agent handles all those routine calls. Patients get instant answers. Staff focuses on complex cases that need human attention. The result? Better patient care, less burnout, more time for what actually matters. That's the smart way to use AI. Automation for the routine. Humans for the important stuff. Now here's what I want you to think about. There are 2 types of people watching this video right now. Group 1 will see ChatGPT Health and think, I'll just let the AI tell me what to do. They'll upload everything, follow every recommendation, never question anything. Group 2 will see this as what it actually is, a powerful research assistant, a way to understand your health data faster, a tool for asking better questions. In 12 months, Group 1 might be confused, following generic advice that wasn't right for their specific situation, maybe even making decisions that a real doctor would have questioned. Group 2 will be informed. They'll walk into appointments with insights their doctors have never seen before. They'll ask smarter questions. They'll catch things early. They'll stay in control. Which group do you want to be in? Now here's the thing. Setting up these systems, connecting your data sources, understanding what questions to ask, knowing how to interpret what the AI tells you. You can absolutely figure this out yourself. I just explained the basics. But the technical part is often the easy part. The hard part is knowing what to do with the information. Which patterns actually matter? When to trust the AI and when to push back? How to translate insights into actual health decisions. That's where most people either waste time or get stuck completely. Here's my framework for using health AI the smart way. Step 1. Use AI for research, not decisions. Let it gather information. Let it find patterns. But keep the final call in your own hands. Step 2. Always verify important findings. If the AI flags something significant, don't panic, and don't ignore it. Bring it to a real doctor. Get a professional opinion. Step 3. Know what the AI can't see. It doesn't know your stress levels, your family dynamics, the things that keep you up at night. Factor in what only you know. Step 4. Stay curious, not passive. Ask why. Ask what else could explain this. Ask what a skeptical doctor might say. The best insights come from dialogue, not blind acceptance. Step 5. Keep humans in the loop for real decisions. AI can help you prepare, but actual medical choices should involve actual medical professionals who can examine you, who can run tests, who can see the things no algorithm can see. Let me tell you what this really means for your life. This isn't about becoming a health expert overnight. It's about changing your role. You stop being the person who shows up confused, who forgets to ask important questions, who leaves the doctor's office without understanding what's happening in your own body. You become the person who walks in prepared, who knows their numbers, who asks informed questions, who partners with their healthcare team instead of just receiving instructions. That's the identity shift, from passive patient to active participant, from confused to informed, from hoping your doctor catches everything to knowing you have your own system backing you up. Here's your action plan. First, learn what ChatGPT Health actually offers. Read the documentation. Understand the features. Know what you're working with. Second, start small. Don't upload everything on day one. Begin with one data source, your latest blood work, or your fitness data. Get comfortable with how it works. Third, develop your question muscle. The better your questions, the better the insights. Practice asking why. Practice asking for alternatives. Practice asking what might be missing. Fourth, build your verification habit. Whenever the AI tells you something important, write it down. Bring it to your next doctor's visit. Make it part of your health conversation. Fifth, stay in the pilot seat. Remember, you're using a tool. The tool doesn't use you. Your judgment, your intuition, your knowledge of your own body, that's irreplaceable. I want to hear from you. What's the one health question you'd love to ask an AI that actually knows your data? The question you've never been able to get a straight answer on. Drop it in the comments. I read every single one. And who knows, maybe I'll cover your exact question in a future video. Look, we're living through a massive shift in how health information works. The tools are here. The technology is real, and it's only going to get more powerful. The question isn't whether AI will be part of healthcare. That's already decided. The question is whether you'll use it wisely, whether you'll stay informed, whether you'll keep thinking for yourself while leveraging everything these tools can offer. My advice? Embrace the technology, but never outsource your judgment, because at the end of the day, no algorithm cares about your health as much as you do. And no AI knows your body the way you do. Use the tools, ask better questions, stay curious, and keep yourself in the driver's seat. And if you're a business owner and you want to explore what AI automation could actually do for your specific situation, I've put a link in the description. You can book a free intro call. No strings attached, no sales pitch, just a conversation about your business and where the opportunities are. If you want to stay ahead of all of this, make sure you're subscribed. I'll see you in the next one. The future belongs to people who learn how to work with AI, not people who let AI work for them. Let's make sure you're in the right group.